Hey, I'm Dr. Greg Lawrence in Germantown, Tennessee. I want to talk to you about female incontinence. Incontinence is a fancy big word that basically just means the leaking of urine. This is really, a lot of younger folks might not appreciate it, but actually at a relatively young age, sometimes in 30s or 40s, just from aging or from childbirth, women will start to leak urine, and it can be very embarrassing. The interesting thing is that men have the opposite problem. As they get older, they have sometimes problems getting their urine out. For women, it's the opposite. There's a very short urethra, and there's the tube that goes from the bladder to outside. It's very short, and all there has to do is just be a loss of the integrity of the tissue, or the angle can change a little bit with the drooping of the tissue, and it's just very, very easy for there to be leaking with a simple cough or sometimes in a position. And women are so embarrassed about this, it really affects their life. There are certain activities they'll avoid. They'll always feel like they have to be close to a bathroom so they can keep their bladder relatively empty or have to change out a pad. So what's the old solution for this? The old solution really are not very good solutions. One of them is medications, and medications have incredible side effects: dry mouth, dizziness, and some women do respond to these medications. We're really glad that we have them. We also do surgery. Surgery is a big deal. It can go wrong. It cannot work out right. And then sometimes a second surgery is less successful. So sometimes patients want to avoid, rightly so, that surgery train. And then lastly, we've done some really odd things with trying to plug a woman. And those are just things that are not solutions that women like. What are the new things? The new things are, we now have ways to restore the tissue to health without surgery, without medications with side effects. And we just like to jumpstart the normal rejuvenation process of the tissue. Because if you have healthy tissue, basically the healthy tissue acts like a valve. And so what do? Platelet Rich Plasma, which is basically your own growth factors, can be used to, again, they're taken from your own blood, we process it, and then we place them without any pain into the right place in the tissue. The growth factors, we think, stimulate stem cells to make your own tissue. After one treatment, the majority of our patients report an incredible response, somewhere between incredible and significant. So just consider, if this is an issue, we want to really be able to help restore your bladder integrity and restore your life. LaserMemphis.com is the best way to get a hold of us. We'd be happy to talk to you about what we can do to restore that for you.